Bone is living tissue, and the inside of a healthy bone normally looks like a honeycomb. But with osteoporosis, the spaces in the honeycomb become larger, reflecting the loss of bone.
I've known I've had low bone density and thin bones for some time, and I've always worried about falling because I was afraid that I would break a bone or have a fracture. I've also thought about it a lot because my mother had osteoporosis, and she had many fractures, and she died from the complications of a hip fracture.
Susan was at risk for osteoporosis because she had a family history of the disease. Other risk factors include age. Bones get thinner as we get older. Gender. Women are at greater risk than men. Ethnicity. Caucasian and Asian women are at higher risk than Hispanic and African American women. Not enough calcium or vitamin D. Lack of exercise. Smoking. And certain medications. Women over 65, anyone who has had a fracture over the age of 50, and those with significant risk factors should get a bone density test.
Osteoporosis is a silent disease until you fracture, but it's before you fracture that you want to do something about it. Your bones are getting weaker and thinner, and there's no way of detecting that except by measuring the bone density and looking at the risk factors for fracture in each individual person.